Good afternoon. This is Todd Streelman, the chair of the School of Biological Sciences, and I want to welcome you all to another town hall where we will address another update on campus surveillance testing. Just as a recap, in our first town hall, we explored the rationale and provided justification for surveillance testing. In the second town hall, we provided updates on surveillance testing after the first week or so and promoted greater and more representative participation in testing. And today we'll provide further updates and analysis of data. Our guests today are Patton Distinguished Professors in the School of Biological Sciences, Joshua Weitz and Greg Gibson. And then also joining us today is Julian Williamson, Executive Director of Sustainability and Building Operations at Georgia Tech, and Team Lead for Campus Surveillance Testing Operation. We'll do presentations by the speakers, and then we'll get to question and answer at the end. We've had questions submitted prior, and we'll start with those. Finally, I want to thank Jasmine Martin, Assistant to the Chair in Biological Sciences, as well as Jess Hunt-Ralston, Director of Communications in the College of Sciences, for help behind the scenes executing and disseminating these town halls. So let's get started. Greg?
Thank you, Todd, and welcome everybody. Thank you for joining in and participating in this event. So, yeah, it's a real pleasure to ask Julian Williamson to join us today. She stepped in, I guess about 6 weeks ago now, and in a 2-week period just completely turned things around for us and made a dream into a reality. And it's great to have her reporting on her side of things today. So just continuing from that theme, I mean, I just need to emphasize each time that this is really a major team effort from at least 30 individuals across different parts of campus. Mike Shannon from GTRI is leading the lab and has established that downstairs in our building. Extraordinary effort, assisted by Mike Farrell, also from GTRI, and Tom Brixton and Dalia Gulick are IBB core directors who've stepped up. Julianne and her colleague Alex Ortiz on the logistics side. And then we have a clear director off campus, Emily Ryan, and an IT lead, Brian Liu, and then all the other people listed there are absolutely critical to operations. This is all supported by the Office of the President and by Andres Garcia and as leader of the Parker Petit IBB at Georgia Tech. Next, please. So just a reminder of the objective here. Really, we want to limit the spread of COVID-19, or at least the virus that causes COVID-19, by removing at least an equivalent fraction of new cases each week, as would otherwise be increasing due to the exponential growth of the spread of the virus. The majority of people who have the virus are actually either pre-symptomatic or asymptomatic, so that means they're not yet showing the 4 symptoms. So the classical symptoms are fatigue, fever, dry cough, and loss of sense of smell and taste. Many people don't have those either because they're not yet showing them or because they're not going to develop them, and yet they are likely to be transmitting to the virus, which reaches its peak before symptoms come. So we're using PCR to identify those individuals and try to get them isolated as quickly as possible. And then not written there, but this is a part of a broader scheme of including responsible physical distancing, mask wearing, obviously, and just responsible behavior, as well as contact tracing, which we can also address questions about. Julianne, do you want to mention a few words about the program?
Sure. So again, thanks for having me. I appreciate this chance to speak with folks and have enjoyed the partnership with Joshua and Greg and the large team that's made this possible. So our program mission is to provide testing for the Georgia Tech community. We have some permanent sites at the Bobby Dodd Stadium, at the Kern Street parking deck, and at 760 Spring Street in Tech Square. We have a number of sites that also rotate, and we'll show a graphic of those on a campus map later, so that we can get to residential housing, Greek residents, staff, faculty, graduate students in areas where they are. These are saliva-based PCR tests, as Greg shared, and you register online. bring a barcode to the test site, and walk up, do your saliva-based test, and receive a result in average on 48 hours. And it's managed through the testing dashboard that there's a graphic of here. But the goal, again, is to provide testing. Our record testing so far has been 2,600 folks tested in a day on Tuesday. And we're continuing to see great participation from the campus. And again, just part of the larger program to help keep the community safe and stop the spread.
So in case there are people on this version that didn't hear earlier, we had some initial delays, which is not surprising at all. And it did take some time to get the first evaluations out, and there's still some stragglers. But that was partly due to some cybersecurity issues that have to be addressed and revamping the website. But that's taken care of now, and we certainly apologize for those initial delays. And then the consent process has been improved, so it really should be reasonably seamless now for people to register, and that continues to be developed for student, staff, and faculty. But please do reach out via the email listed there, mytest@gatech.edu, with any thoughts that you have, and we'll do our best. We have a team that will try to respond to those. If not Joshua and myself and Julianne, somebody will be getting back to you, and we'd like to hear about what we can do better. Thank you. Next. All right, so as I mentioned, this is part of a multi-pronged approach. Actually, maybe Julianne, you want to talk about this one since your photo's up there?
Sure, I'd be glad to. So we recognize there are three large areas of testing we wanted to point folks to, and things can get a little complicated when we talk about what site for what type of testing. So Institute Communications put together a single website about all things coronavirus testing, and you'll see the link here. It's on the Stamps Health website, just under coronavirus and testing. It outlines the options on symptomatic testing and asymptomatic testing. We also had a high-level focus on reentry testing, and that was for, of course, all students coming back, but also the staff with high touch points. So how could we get testing to custodial and trades and facilities and housing who would be working on a large scale with a lot of services, a lot of people around. And again, these are complemented by external resources such as the Fulton County Community Testing Site that we have at the McCamish Pavilion. It's open Tuesdays and Thursdays, and provides a good additional testing for our community members. So that covers this one. We can hit the next slide if you like. When we talk about asymptomatic testing, the reason it's important to have a pretty clear decision tree on the website is there are a lot of options. Symptomatic testing is done through Stamps. They now have after hours and weekend testing available. Those after hours and weekends are not rapid tests. They are the saliva test administered through appointment arranged by Stamps for students. So those are available. On the asymptomatic testing side, again, this is all walk up. You do not schedule an appointment. You can go to any site anytime it's open. If you're a Georgia Tech student, employee, and we have the large-scale facilities open daily on weekdays, hours of 9 to 5. That's at Bobby Dodd Stadium, Curran Parking Deck. And these are actually layered onto the campus map now at map.gatech.edu. You can see a view like this. The Tech Square site is open Wednesdays through Fridays in the afternoons and Thursday evenings. So we'll be open until 7 p.m. tonight. We are going to extend our hours starting next week to be all day, Wednesday through Friday, 9 to 5, with the evening hours on Thursday evenings. We have what people are referring to as mobile or pop-up sites, really taking testing to the students in the community. We have residential housing testing sites, and Campus Services has a team of staff that hit Glennon Towers Connector on Monday and Tuesday afternoons, North Avenue in the Centennial Room, where we have 3,500 plus residents, Wednesdays and Thursdays, 12 to 4, and then our primarily graduate student residential population at 10th at Home, and that's Friday afternoons. We have two what we call pop-up sites. One is in the Cadell building. It's open Monday and Tuesday afternoons between classes. They've graciously allowed that ground floor classroom in Cadell to be used as a test site. And then we do have Saturday testing from 9 a.m. to 1 p.m. And that's in a residential venue. And it's really informed by the analysis that Greg and Joshua do on the testing data from the week to say where we have gaps in testing or where we have some rates that are concerning and we want to push people toward through folks' communications towards a test site. So this past weekend, we were at Glennon Towers connector because there were about 5 dorms where we needed to see that participation increase. So we had a better handle on what was going on in the residence halls. So that's an overlay of the asymptomatic testing sites. And again, you're welcome to come to any site. Just walk up, have a barcode, a new barcode for each test. We scan your barcode, we scan a test tube in your test kit that you'll receive. You provide your saliva sample, and that's taken to the lab for processing over at EBB. So that's how the testing sites run. So I'll turn it back over to Greg and Joshua.
Okay, thank you, Julianne. So this is a figure you've all been waiting for, I suspect. So this is our timeline of what we've seen in the first month of testing. So we started on August 7th with the arrival of freshmen, and were observed around about 1%, or a little bit under 1%, which we think is about the rate in the community, in the Fulton County community anyway. Then it went down, and as you may recall, that was when our next town hall was, and we saw it, pretty close to 0, and that we were concerned that people weren't getting tested who maybe should be getting tested. And pretty much the next evening, we started seeing things go up. And then the upperclassmen re-entered, and there was a spike. And then the very first case of an outbreak in one of the Greek communities happened. And we decided to put intensive sampling of the Greek community or the Panhellenic community in. And that's where things spiked up to 5%, and things, at that point were looking quite alarming. And then maybe partly because of the consequence of that, or just naturally, it went, well, not just naturally, but it went back down to close to 1%. And then we started seeing some events in some of the dormitories in late August. And so we also initiated very intensive targeting of the dormitories, as many of you are aware. And I think that's really helped a lot. And then the last week, or the first week of September, which was last week, things were down at 1%. And then we've just got some new data today from people coming back from Labor Day weekend, and things seem to be even lower, perhaps down about 1.5%. So we're hoping that that's going to continue. We'll find out over the next week. But that's good news. I think Joshua has another way of looking at this here. You can just explain.
Yep. And can you hear me, Greg? And others?
Yep. You're good.
Perfect. So this is just another way of looking at the same data now spaced out by day. And this is really a readout of what you're seeing on the mytest.gatech.edu site, which is the number of positive tests now focusing on the surveillance by date divided by the number of total tests taken on those particular dates. And you can see error bars here in part because we're getting different number of tests for different days. And like Greg said, we saw an increase from below 1% to almost 4%, if not on within certain sliding windows above 5%, and is now back down around 1%. And this should be coming out later today of 22 positive tests out of 1,800, or 1.2% for our first post-Labor Day sample. And just as context, when we see these sorts of positivity numbers, and you may have seen other positivity numbers from Fulton County or from the state of Georgia or nationally. And in Georgia, they typically have been around 8 to 10%. And we have to have a caveat there because those positivity numbers reflect a whole bunch of reasons why people get tested, not just because they think they've been exposed to some extent with surveillance, but often because of exposure, because people have symptoms and so on. So we expect that number to be much higher. When we look at the actual number of cases in the last few weeks and use that as an estimate for circulating cases, assuming that we're under ascertaining in the state as well as in the county, our baseline expectation is that a community level rate in an equivalent sort of apples to apples way should be about 0.6%, could be a bit above that, could be a bit below. So we're getting back to levels that resemble that of the community at large. Now, that doesn't mean we shouldn't continue to take precautions and still be vigilant, but certainly there's within community transmission, but it is no longer at levels that begin to depart markedly from what we're seeing at community background. I do want to begin to unpack these numbers, and that's something that we're going to be doing quite a lot today. Because when you see numbers of about 1%, that doesn't imply that if we look broadly across the community, there's an equal chance, 1 in 100, let's say, that any individual might be positive right now. Another way to look at it is by looking within those groups of students who are living in dorms, students who are living in Greek houses and other, and that includes both students who are living off campus as well as faculty and staff. And what you can see is that in all the groups, numbers were going up in late August, and in all the groups, they began to come down, but there still has been, particularly after those initial clusters within Greek houses, something systematic about an increase within the Greek communities, meaning there's a higher chance of individuals testing positive in those communities vis-a-vis dorms and within others. So this gives you some context for understanding fluctuations that may happen from day to day are affected not only by what's going on within the spread of COVID-19, but also test participation. Yet another reason why we want to make sure we're really testing across the campus community. So that's a broad take on variation of surveillance positivity by category. And if we add these things up as a whole, of course, the number of individuals in each of these categories differ, but it's about a third each within these broad categories, which again reinforces the notion that since there are many more students within dorms, there's a elevated risk has been an elevated risk of positivity within individual students living in Greek housing vis-a-vis dorms. There are some caveats here with respect to differential testing rates and total testing coverage. The good news is that positivity percentage have begun to drop on all three categories and also begin to equalize. The gaps between them are a little bit smaller over the past 2 weeks. That's leading up to Labor Day, and we're beginning to see some evidence moving forward, but it's too early to tell. Even with,
do you want to just add there that this is a surveillance program that includes staff and faculty. Thankfully, we've not had any faculty cases yet. We have staff cases, but I think 98% of the cases of the positives have been in the student body so far.
And I'm sorry, I should have been more careful here, that these numbers actually are within all of the categories of testing, and I apologize for that. So this is across the entire set of testing categories, symptomatic, asymptomatic, and so on. Apologize for any confusion there. Thank you, Greg. So now looking again within Greek houses and looking particularly at variation within house to house, and I'll do the same from residence to residence. What you can see here, and these are ordered by the number of individuals, not necessarily by positivity, the total bar denotes the number of individuals who've tested positive for COVID-19, SARS-CoV-2 within a particular Greek house. All those on the left that don't have gray bars denote the fact that 16 of these houses, as of this particular test date, had 0 documented cases, and about the same number had 5 or more. The red bars within those denote positive tests within the week. And that, again, as you can see, there's some houses that have had cases. Those individuals have been isolated. We've had no new reported cases within the past week, again indicating the fact that it is possible to detect cases early enough and then stop continued transmission within a Greek house. We've also seen cases where there have been quite a large number of individuals, some with on the order of 50% infected or more, and some that have continued to see new cases. And those are obviously ones in which, for example, one which may have had a few cases before and then 5 or 6 in the past week are concerning, and obviously those are indicators that we want to go back and continue to do targeted testing and contact tracing within those focal communities. One can also see similar sorts of results within residence halls, where a number of residents have 0 documented cases, and I should caveat that with the word documented, meaning that those are those that we've detected, and 15 to 48 have 5 or more cases, all of which have been less than 20% total positivity. You'll notice that some on the right, those are some of the largest residence halls. So at present, we understand that in these larger residence halls, there's going to be higher incidence, and we're trying to then tease apart even those numbers and breaking down where some of those cases might be. Are they clustered? And if they are clustered, to use follow-up testing to, again, try to stop chains of transmission before they expand. And I'll let Greg talk a little bit about what this means more broadly.
Yeah, thank you, Joshua. So this is another way of presenting that. data, but now it's proportional instead of just the straight numbers. So you've heard of the 80-20 rule. In this case, we're something more like a 75-25 rule, meaning that 75% of the cases are attributable to 25% of the dorms or houses. And so on the left-hand side there, that double pillar is the residences, which overall have tested at 4%. So that's about 1.5% per week over a 4-week period. That's the cumulative numbers. And so this is for the first month. There are 6,201 occupants of residents have tested, and of those we've seen 244 positives across symptomatic and asymptomatic testing. And so just two of the larger residence halls, Glen and Towers, have actually accounted for about 20% of the cases. And then there are some others there which are all sort of clustered close to that sector of campus near the stadium, where we're seeing the higher numbers, and so that's where a lot of our focus has been. And then we're also seeing that around about a fifth of the residences, as Joshua showed, have no cases whatsoever. Similarly for the Greeks, the left of the two pillars is showing the proportion of all of the 1,200 occupants in each of the 37 different houses. That's each bar is a different color. And then the proportion of the positives is elevated for the top 1/4, collectively explaining about 3/4 of the cases. So that's why we really try to go in and target specific residences where we're seeing most of the cases happen. Next, please. And then another way to look at this is to say, well, what impact have we had? So, of course, we can't necessarily be certain that our intervention is causing this, but it's extremely consistent with our theory and encouraging. So each line here, each colored line represents one of the houses or dorms below that, and the cumulative number of cases reported over this 3-week period. And you see that they all start out with a jump to maybe 5 cases, and then in most cases they've leveled off. Okay, so even the large infections, the big outbreaks we knew about, Sigma Phi Epsilon was the first one, that's really plateaued off. Same with Kappa Sigma. There's a couple there, Alpha Tau Omega, for example, which last week were going up. I'm not sure what's happening this week. I think it's come back down. Well, it's increasing at a smaller rate. So that's when we see things like that. That's when we go in and say, we really need to target the testing to make sure that doesn't spread more rapidly. But the bigger picture is that in the vast majority of cases, we're seeing a plateauing off, which is consistent with the idea that we've been able to isolate and prevent further spread. And that's true not just of the Greek houses, but of the residence halls as well. Next slide, please. Okay, well, that's a positive interpretation. It looks like it's working. It's very consistent with the way we drew it up. However, there's some caveats. So one is that we only, and now that's in inverted commas only, saw 60% participation the week before Labor Day. As you know, we're aiming for 100% each week. And the concern is that maybe some of that drop is due to a high-risk subset who are more likely to test positive deciding not to test. That was our concern at the last meeting. I have no reason to say that that's happening. I hope it's not happening, but it's a possibility that could be driving the numbers down a little bit. But even so, we're clearly not up at the 5% a week level right now. There's been some rise in symptomatic cases, slow. Again, doesn't appear to be exponential, but it's a concern. We don't yet know what Labor Day long weekend travel may have done to reset the rate. So people coming back and being tested yesterday would probably not be positive yet if they contracted something on Saturday or Sunday. But we'll keep a good eye on that over the next week. And then the other thing I'm just trying to say there is that we're working towards providing this aggregate data statistics at the house or residence hall level to the community online. And I expect in the next couple of weeks we'll have a solution to that we're all confident is the best way to present the data with minimal anxiety and maximal transparency. But the bottom line there is, please, everybody, try to get tested this week. From Thursday through Saturday. Next slide. And again, just to emphasize, we're going to watch closely what's happening at UGA, Georgia State, and others, Kennesaw State, who don't have the luxury of having the surveillance program that we have in place, and see what happens there over the next few weeks. So that will really be confirming that what we're doing is working. But irrespective of that, we're really encouraging people to continue to wear that mask in public, maintain your distances, and just continue to act sensibly. They're by far the best forms of protection. We know that the off-campus student rate is also between 1% and 2%, maybe around 1%, and that's going to continue to import cases onto campus. So even if we were to make bubbles out of the residences, we'd still see incoming cases. There's absolutely no reason to get complacent whatsoever. And just a reminder that if you think you're exposed at some point, just minimize your interactions over the next few days and then wait before you get tested, because it's going to take several days for the virus to appear in your system. In some cases, it can take up to 10 days, but the average is 3 or 4. So please heed that advice. I think I have one more slide. So as you know, we made a recommendation to split individuals from shared rooms in the residences. And the reason for that is shown here. We saw that there were, by the end of August, there had been 164 positives recorded in the doubles. So these are rooms where 2 people are sharing the same room, sleeping in that room, presumably for 8 to 10 hours a night, probably sharing it for much of the other time, oftentimes without masks. And so 78 of those 164 positives in the doubles were, in fact, so that's half of them were sharing a room. And if you break that down, it means that 30% of the doubles with at least 1 positive saw that the second roommate contracted the virus over the next week with a median time of 3 or 4 days. Okay, so that's when they tested positive. Again, this is asymptomatic testing for the most part. So the inference from that is that, if you were sharing a double room, your rate of contracting it was much, much, much greater than the background. We saw almost identical rates for the quads, so that's rooms which can take up to 4 people, but we're all housing 2. So 10 of the 22 positives were observed in 5 of the 17 shared rooms, almost identical stats to the doubles. And then by contrast, in the 53 suites where we saw positives, so that's suites where 2 to 6 people share rooms around a core living area and shared bathroom, 58 positives in that case, so it's a smaller rate. And just 10 of those had shared a suite. So in other words, that was about 17%. So if I break that down, I'm estimating that sharing a double or quad increased your odds 7-fold and a suite 2-fold. They're minimal estimates. And that's why we made that recommendation to split people up. And we think that policy is probably going to prevent at least 100 primary cases over the course of the semester, and then knock-on effects of that will probably be even greater. Now, we do understand that there are other reasons why students will not want to split up, but we're just trying to indicate why we made that recommendation. Next slide. And so that's over to you, Joshua.
Thanks. And I want to go reinforce, I think part of the central message today has been one of heterogeneity. And we recognize that has been the case within COVID-19, that even if it's affecting populations en masse, there'll be particular sectors of society or particular groups or particular contexts or setting in which there'll be an elevated risk, and other contexts and other groups may have apparently a lower risk. Now, those things can change, obviously. But one of the reasons, therefore, we've been talking about high rates of testing is to think not whether or not other people have tested, and therefore, if let's say those folks in a different residence hall or dorm or Greek house have tested, that's going to indirectly protect me. The issue is that within individual residence halls, we should really start to think about essentially hierarchies of risk. And as Greg just laid out, that can be from sharing a room and a double, right, to sharing common spaces, to then being in the same floor, sharing a bathroom, or into the dormitory or building itself. And so we really want to make sure that we're testing each of those units at high levels so that we can get sentinel or early warning signs that there may be an outbreak. I've shown this once before, and I want to reinforce it again, particularly because of the necessity to have high levels of testing at the granularity of individual live-learn communities, meaning the residence hall and Greek houses. And just as an example, as an illustration, here on the left, 100 individuals of which there may be 15 infected. On the right, only 4. And if we're trying to look for anomalies, anomalous cases, we know there's background levels. How can we figure out that 4 seems a bit high? We need to see at least 3 to get a sense that something is off there. So the question is, how much do we have to test? You can already begin to see that if we test a subset of folks in an anomalous or incipient outbreak on the right, we might just find one case and not really have an indicator that something is amiss. Whereas when there's already a large outbreak, as you see on the left, then a small sample will give us an indication and we could go back in and test more. The problem is, as you can see, then it really is already too late. So to formalize this, if we want to detect 3 or more cases, and this is an example in a group of 100, how many people do we have to test? If the actual outbreak size is 4, as you can see on the x-axis here, the number of individuals to test is at least 90 in order to be almost certain that's that 95% level there that we're going to detect 3 of those 4. Whereas if 15 people are already infected out of 100, we only need to test 35%, but again, by then it's too late. We're trying to avoid that outcome by testing early. So the message to the community continues to be that surveillance testing is there intended to be comprehensive. The capacity exists to test those students who live and learn on campus. As Julianne said, Tuesday, apparently a record-breaking day in terms of 2,600 per day. There are about 7,500 or so people who live on campus. There are a few thousand more who are coming on daily. So the capacity does exist and has been expanded due to the incredible work of that logistics and testing community. And by doing so, we're getting early warning signs and being able to detect outbreaks earlier rather than later, which can then obviously pose a risk to those who are infected and to those around them, the community, their loved ones, and so on. So just to give a sense of progress, as Greg noted at the beginning, we had importation of cases as we drew back folks to the community, which was then followed in late August with an uptick up into the level of 4 or even 5% on some days, in that range. And we've seen through the combination of intensive testing, and we've seen also evidence of sustained efforts by many to reduce gathering sizes, a decrease in our positive ratio to about 1%, and our early indication of 1.2% post-Labor Day is cautiously optimistic that this continues to work to help to mitigate and avoid these sort of exponential rises in cases with respect to this asymptomatic surveillance program. And again, we've made critical gains collectively, and I mean that collectively, not just the testing program, but the campus community, in identifying cases in clusters, using targeted testing isolation to reduce risk to many, and that is helped and enabled by all these other ways, mask wearing and physical distancing, that just makes the benefit of our testing strategy more effective. The lower the intrinsic rate of spread, our level of testing can be more productive in terms of keeping risk low. And again, it's part of an integrated effort. It's not the only part. And so we should remain vigilant and not get complacent vis-a-vis other ways in which we can reduce spread. So again, to highlight just 4 main points of takeaways and recommendations continued for the fall term. We've had a build-up and scale-up of entry testing. The logistics enabled by Julianne and her team has now got to the point where we can have the capacity to test those who live, learn on this community weekly, and we're encouraging all those who live, learn on this community, whether you're living in a dorm or in a Greek house, to be tested weekly, particularly those who are faculty and staff with high touch points to do the same. And the other point is that for those of you who are off campus, working off campus, that is fine. For those who are coming in frequently, the capacity exists, and the nature of testing, the locations of testing and hours are meant to make it easier on the community to get tested regularly, and we welcome feedback at mytest at gatech.edu. Continue to wear masks inside buildings, and there's been distribution of disposable masks around campus, which has also helped. The modality continues to be online as default, and obviously there are hybrid modes, there are occasional face-to-face interactions, but for the most part, we continue to recommend that if you're teaching a class which has predominantly online modalities, continue to do so. This may change as conditions warrant, but again, given the pause after Labor Day and the fact that we still remain hovering around 1%, we strongly encourage those to keep vigilant up and minimize group size. And that goes back into these essential interactions and risks. Reduce indoor gatherings whenever possible. And avoid large gatherings by trying to gather in small groups outside. Wearing masks is obviously going to be far safer than gathering indoors with many people without masks. So try to find that low density, or in some cases, virtual alternative. In doing that, we're not just helping ourselves as individuals, but we're acting empathetically with respect to those who are often the hardest hit, essential workers with high touch points who may be interacting in facilities or in dining and building throughout campus. And in doing so, I'm grateful for the interaction and feedback we've already had. We've had dialogue with members of the Greek community trying to learn ways that they can continue to keep up their testing levels. We've been contacted by others in dormitories trying to find new incentives to really bring this testing as part of a social norm to campus. And with that, I think we've reached the end. I want to thank again Julianne for her part of the presentation. Greg, on behalf of everyone in the testing team, we'd be delighted to take questions.
Okay, so we have a number of questions that were pre-submitted and also a few that are popping into the chat and Q&A. While the three of you are here, I think it may be reasonable to review protocols from the start. So maybe we could start with Greg and take us from when there is a positive in a pool test to how the individuals are notified, confirmed by a diagnostic test, how long that takes, and then how individual contacts might be traced from those individuals. All three of you can contribute to this answer, but let's start with Greg, perhaps.
So, yes, thanks, Todd. So the samples are brought in from the collection sites 3 times a day, and the team downstairs starts processing them immediately. And we have about a 24 to 36 hour typically turnaround time with our double pooling strategy that I won't describe here. But what that allows us to do is to process samples in batches of 225, and we do about 8 to 10 of those batches a day, typically. And when we look at the results of the PCR tests that are done, we were able to identify cases in sets of 6, and then within that set of 6, we can say, well, this was the person who was most likely positive. There's some ambiguity to that occasionally, so what we do at that point is then take all of the presumptive positives plus the ambiguous ones, and we retest them in a clinical diagnostic framework. If that is confirmed, we then report the results to the surveillance site, Mike Shannon reports the results to the surveillance site, and he also reports the results to STAMPS, which in turn follows up and presents those results in a very formalized manner that you guys won't see, but that gets reported to the Department of Public Health according to federal regulations. At that point, STAMPS then engages their, and so I should say that we know the turnaround time. It's typically, at best, I think the record was like 24 hours or 25 hours, but it's typically about 48 hours from you giving your sample to getting the result back. And at this point, the negative and the positive results are presented in a similar time frame within hours of each other, in most cases. And I know myself, I've been tested, the last couple of Fridays and had turnaround results within 36 hours, which is fabulous. And then for a positive result, STAMPS engages their contact tracing staff, who will go out and first of all, they inform the person who's tested positive, usually by phone, and then they're directed as to how to go into a quarantine or given the option to return home or other options. Julianne can expand on that a little bit. And then the contact tracing team will kick in to try to talk to the positives about whom they've been in contact with in the last several days. Julianne, do you want to take it up from there?
Sure, I think you covered a lot of the points. There are specific areas of interest. I think the isolation, I was trying to pull up the information from Ben Holton. When folks are exposed, contact tracing definitely starts within 24 hours of that notification, and they get about 3 to 5 folks. Dr. Holton says per account. When it comes to quarantine and isolation, we do follow CDC guidance and recommendations on limiting contacts. When people are exposed, you go through that tree and you start reaching out, and then people have options to choose from, and those are best laid out on the health.gatech sites under FAQs about how to avail themselves of either their own residences, on-campus options if they are on-campus residences, and then the support structures that are in place for those. So we're making every effort to make sure that that is easy and comfortable for students who are impacted, and recognize it as a very difficult time for people once they do get a positive diagnosis or that they've been exposed to someone with a positive outcome. So we do have a lot of information laid out on, again, health.gatech.edu under coronavirus testing. And I think that's a great resource to drive people to if they do have questions, because there is a good bit of misinformation that, you know, is out there in social media and anecdotal stories about things. But it's going back to that STAMPS website can really help clarify the specific protocols.
Julianne mentioned Dr. Ben Holton, who is director of STAMPS. I neglected to mention that. He's been a fabulous partner for us. He runs all of the surveillance tests and does all the reporting. Impossible to work without him and his stuff.
Okay, thank you guys for answers to that one. There's one that popped up in Q&A that I think we should take. The question for you is, why has Georgia Tech chosen not to follow CDC testing recommendations? They recommend that if you do not have symptoms or do not have close contact, you don't need to be tested. I think you guys have done a good job of laying out the rationale for surveillance testing, but could you just address that one head on?
I can take that one to start, which is that I recognize that that particular guidance, which I think the questioner may be referring to, has been controversial, and many public health experts and those working on COVID-19 response, myself included, have not necessarily agreed with the interpretation. I think it's important to give a context for that guidance. So the CDC's guidance that people who have symptoms of COVID-19 should get tested. And they also say not everyone needs to be tested. Those are literally the words off their page. But that doesn't mean that if one has the capacity, one shouldn't use the capacity. So in many circumstances in which there's far less capacity than we have, then there's a question of how do one use a limited resource to make sure that one can effectively try to identify individuals and initiate contact tracing. We are in a different position. Through the work of the logistics, the laboratory team, we're now at a stage for which rapid testing and surveillance testing can be used as a form of mitigation. And so if you go in to get an asymptomatic test, that is not depriving of anyone of a test that they might otherwise need to get. To the opposite, the level of testing that we're using right now was designed to intentionally try to identify people, which is widely recognized. Pre-symptomatic and asymptomatic transmission does happen and is a major cause of the transmission of COVID-19. So our hope remains that by making this strategic and intentional choice, we are using a large-scale research that we've developed in a way that other universities and other locales have tried to do or beginning to do, but our capacity does mean that we can use testing in a different way. So I hope that gives some context for the rationale.
Yeah, I'd add two things to that. Thanks, Joshua. So one is you've got to see this in the broader context that there's limited testing nationwide, in fact, internationally. I mean, there just aren't enough tests to test everybody in the country. There's 300 million people every week. So when you have to focus your resources, I think that's partly behind the CDC guidance that we should focus them on symptomatic people. But as Joshua mentioned, we do know, and it's very, very clear and has been for months now, that asymptomatic people are transmitting, and in fact, the virus is at a peak before people become symptomatic. So it makes sense to intervene at that very earliest point because that's when the danger is highest. The second thing is, if you look at the earlier version of the guidance, it said that there was no evidence that asymptomatic screening stopped the spread of the virus, which is true, but nobody had done it on any scale, so there was no chance for there to be any evidence of that sort. There is now, and I think we are going to be living proof that is the case. But that's certainly the reason behind our advocacy and the acceptance of that policy by the upper administration.
Thanks for that answer. This is a factual one, but it makes sense to repeat. The question is, what is the size of the actual on-campus population for this fall term? And then do we have the testing capacity to reach that 90% number that you guys have talked about previously?
So I think I can hit that. It's about 7,500 between housing residents and Greek residents in a Greek house. We track both of those populations. We do have capacity to test, as Greg shared. Our maximum test collection is 2,600 tests a day, and we regularly run at 2,000 a day. So we're seeing weeks where we have 10,000 tests completed, and that could be one individual testing twice, but we do duplicate the results. So we feel like we're hitting a large portion of that population. We can hit more, and our goal is, as Greg said earlier, to hit 100% and have everyone living on campus test weekly.
Yeah, so it's about 6,000 residences, about 1,500 Greek residences, maybe a bit less now, 1,200 Greek residences, and then another 1,500 a day are probably visiting campus from off campus, but cumulatively that's probably up maybe 5,000. So we've had about 14,000 people register to be tested. And you know, we'd be pushing it to cover 14,000 people a week. We can do it, but it's actually the limitation is on the sampling side more so than on the testing side, and that's not so much because of logistics, it's just because of not everybody is going to find the time to be able to come and get tested every week. But yeah, we can cover
it. Okay, this one has this question or comment has to do with testing locations. The comment, which turns into a question, is that the week when we had temporary testing locations open seems to be the week when we had the most students taking the time to get tested. And so the follow-up is, can these locations then be open once a week, every week?
Sure. So if you go to the campus map, map.gatech.edu, the top layers are actually the testing sites and the pop-up sites, and you can turn those off and on, and you'll see that all of those sites are operational during any week. Housing runs sites at residence halls, 2 days at Glennon Towers, 2 days at North Avenue, 1 day at 10th and Home. We open Cadell 2 days a week, and we open Tech Square, 760 Spring Street 3 days a week. We also offer the kind of core Bobby Dodd and current parking deck sites daily. And we offer a Saturday pop-up site at one of the housing locations. So we do have good coverage of campus, and that's a testing staff of 30 people engaged in those locations. And we're looking at ways to continue to bring testing closer to folks. So they're welcome to contact me with ideas or needs. We're working with GTRI on their populations, with athletics, to get their populations tested. But again, always open to talking, and we're using non-testing sites as well. So second and third shift staff in particular, we're using our Vault kits, which are saliva-based tests that we have purchased for the populations that can't get to a testing site. We've shipped those down to GT Savannah for testing, and you can administer those remotely through the web. They're shipped to the lab for processing, and then we do get notification. Dr. Holton in Stamps does get notification of any positives that might arise out of there. So we're trying to have a very comprehensive testing strategy and really take testing to folks. So it's very convenient. We don't want any barriers to accessibility on this.
Thank you. Next one, we've seen this one before and we haven't answered it explicitly. The question is there an established metric such as positivity rate or number of cases at which Georgia Tech will shift to purely online classes? And the follow-up is, does Georgia Tech have the authority to make this decision, or is this decision up to the university system of Georgia? And I'll take the first stab at this one as a school chair, and then I'll let you guys follow up. As it stands right now, the university system is making these centralized decisions about opening and closing its institutions. And some of you may know, but the USG supervisor oversees 26 different institutions throughout the state. And many of these have very different local situations, very different mission statements. When we closed down in the spring, it was a system-wide mandate that did that. And when we opened up in the fall and stated that we had a goal of a partial or a purely residential semester, this was also a system-wide decision. So with that in mind, I think the strategy of this surveillance testing has really been to invest in things that would allow science-based and near real-time recommendations to be made that give us the best chance of staying open throughout the fall semester. So really our role is to provide updates and analysis of data for faculty, staff, and students. And of course, this data is being used to inform Georgia Tech's executive leadership team as they advocate in the interest of Georgia Tech. You guys have anything to add to the answer?
Yeah, I mean, there's not a number. I mean, we're on discussions. There's not a number that's been said that if we exceed this, we would go to complete online learning or shut down or anything like that. And I don't think there should be. I mean, it really is about trends and seeing where things are happening. It's not about a mean number. It's about just tracking the whole trend, as Todd just said. And the other end of the picture as well, we can legitimately ask the question at how do we, if we keep it below 1%, get it down to less than 0.5%, are there things that could be done to open up specific parts of campus? That discussion's not being had, but maybe will. And certainly as we get into the spring semester and we continue the surveillance program, just so many unknowns. Nobody knows if this thing's going to increase, what's going to happen in the spring. Flu's coming. We know that. I don't know if that will affect COVID rates. The symptoms are different, but we're now going to have a lot more people getting symptomatically tested. It's just a lot of moving parts. Joshua?
Yeah, I'd only add one thing, which is I think that there are good discussions to raise. I think some of the efforts to think about barometers for where things stand, you can't rely on a single metric. As Greg said, if we see a 4 or 5% and are passive and haven't been aggressively sampled to try to stop changes of transmission, that's a very different outcome or trajectory than using that information to make a change. Now, on the other hand, there are capacity issues with respect to expectations for quarantining and isolation. And so I think those also have to become factors in terms of making campus decisions. Throughout, our intention here has been to drive down new cases to avoid exponential spread. And in fact, we're beginning to see actually percentages go downwards. In the long term, the reason it's quite hard to make those predictions is other factors come into play. There's some early indications that flu season in some circumstances has been less severe than expected because of physical distancing induced by behaviors surrounding COVID-19. So I think at present, our job from a science side is to do our best to try to identify cases, mitigate, but we also have a duty to think in a broader sense. Are the actions we're taking continuing to make a safer environment for the community? I think the answer so far has been yes, that the testing has been effective, the collective work on mastering has been effective. We also have to keep in mind that COVID-19 continues to transmit within the community at large, so we're not in a bubble. So I don't think we have any expectation. If I shift it around, I'm a little bit less optimistic than Greg is about talking about changes of modality now because of the complacency issue. And even if we got in-campus transmission to be near zero, we will get new imported cases. And so we need to continue to sustain. I'd be focusing now simply on saying, can we continue to keep levels and positivity rates low and defer those questions of changes for later in the fall?
That phrase, less optimistic than Greg, is not one you hear very often.
This is an easy one, you guys. When will surveillance testing end? And I think that the question is basically asking whether we will continue this into the spring semester.
Spring semester of 2022, if it requires that. That's not. I mean, so long as it's successful, it'll continue. And this is not going away in January or February. To prevent new outbreaks, you just got to keep vigilant. And that we all want to get to a point where research is carrying on, where students are back on campus doing more and more things. But as Joshua just said, we're not there yet by any stretch of the imagination. But we'll keep an eye on it, and the aim is to get us as close to normal as quickly as possible. But so long as that's not the case, we'll keep testing.
Okay, one final question before we finish up, and this reflects some comments from parents who have asked what parents can do to help the effort. So it's a fairly open-ended question, but it will allow you guys to summarize as we close.
From my perspective, it's encourage your students to get tested. Encourage them to get tested, encourage them to report a positive result if they didn't test through surveillance, because it's about keeping the community and themselves safe. The more we can test and protect each other, I think the better experience this will be for all of us.
Yeah, it's about that message that it's about respecting everybody. I mean, I get it that there are people who don't think that testing is necessary. I mean, young people don't get sick, but then there's a lot of other students who are very anxious about it. We all have different approaches to this, and I think the default position should be respecting the needs of everybody. And that's, masks are a pain, social distancing is not nice, but it's working, and it's keeping us safer and keeping staff out of harm's way. And we can't underestimate the critical role of 5,000 members of staff who keep us all going. They need to be protected. So that respect is a message that I would love to hear.
I agree with my colleagues. I'm not going to have too much else to add.
Okay, we're very close to 5 p.m. So I'll just, again, thank you guys. Thanks for everyone who's attended. These town halls are later broadcast on the College of Sciences YouTube channel for anyone who missed this, or if you'd like to promote the dissemination of this information, that's a great way to do it. With that, thanks again, and until next time.